Hello, hello, hello. Welcome, everybody. Welcome to Kidney Stories 2. I'm your host, Uncle Jim Myers. Tonight, I have something extra special for you. This week on Kidney Stories 2, our guest is Payal Shah, pediatric kidney patient, 22-year kidney transplant patient, and doctor of pharmacy, and also an AAKP ambassador. Payal works for a biomedical company that researches rare diseases, including chronic kidney disease. And tonight, we're going to cover a new topic for the show, generic testing and counseling. So please give a warm welcome to our friend Payal Shah. Oh, Payal, how are you?
I feel like an all-star with that intro. I love it. I love it.
Well, you are. You definitely are. So I've been meaning to ask this, and I meant to ask you before, but I didn't. You're a married lady, right?
I am a married lady. That's
and
right.
what's your husband's name?
My husband's name is Vinod, V-I-N-O-D, but everyone just calls him Vinny.
Vinny, okay.
Yeah.
And do we have any children yet, or we're not quite at that stage?
No children, not quite at that stage, but we can certainly get into that in a little bit as I start telling my story.
Okay, so let's talk about your life as a kidney patient. It's my understanding that your kidneys have failed. Can you tell us a little bit about what's going on with that?
Yeah, absolutely. So first and foremost, thank you and hello to everyone. I hope everyone is safe and healthy and enjoying their Friday ening. A little bit about me. I was diagnosed with kidney failure at the age of 15. There was no family history, no known cause for my kidney failure. The thought was that I was just born with weak kidneys, and over time they gave out on me. I presented to urgent care with a lot of fluid overload. I had a lot of edema, shortness of breath, and really I just knew something was wrong. So that's kind of what urged me to, tell my parents, hey, I need to get checked out. Spent a better half of the evening in urgent care, and they took some lab work, and where they found that my creat levels were out the roof. And so immediately they said, all right, well, something's going on with those kidney beans. So let's dissect this a little bit further. They determined that it was likely that I was having kidney failure. And so they admitted me into the hospital pretty immediately. And I was prepped for hemodialysis. Unfortunately, to this date, I don't have a known diagnosis. We did do a biopsy, but it was inconclusive. By the time they went in to do the biopsy, I was pretty much sclerosed over. So the pathology report was very difficult to dissect. It kind of just came out as glomerulonephritis, which unfortunately does not offer a pinpoint specific diagnosis. It's very generalized. But nonetheless, they placed me on high dose steroids to determine if I would regain any kidney function. And I was placed on hemodialysis. Fast forward, I was on hemodialysis for 6 months. And I was then transferred over to peritoneal dialysis for 6 months. And the reason why I was transferred over to peritoneal dialysis was that hemodialysis was, I just wasn't faring well. I was constantly tired. My blood pressure was not in control. I actually had a couple of seizures while on hemodialysis. And so the decision was made to, first of all, my family and I decided to switch pediatric nephrologists because we felt that some of the decisions that were made in that time frame were not best for me. And hence why I was not successful on hemodialysis. I did not thrive on hemodialysis. So 6 months in, we decided to place my catheter for peritoneal dialysis. And I tell you, the next 6 months while on peritoneal dialysis was, I hate to put dialysis in a good category, because we all know as kidney patients how taxing it is. But quite honestly, peritoneal dialysis was a godsend. It at the phase of life that I was in, being in high school, quality of life, the freedom to eat a little bit more, to drink a little bit more. Peritoneal dialysis was just great. And I thrived. I literally thrived on peritoneal dialysis. I was placed on PD for 6 months, and I was very blessed to have a living, unrelated donor step up to donate his kidney. And I am now 22 years out post-transplant. So, my journey as a transplant patient has been very lucky, I would say. I do what's in my control to take care of myself. But certainly I'm very well aware that 22 years is no small feat, and very thankful for it.
Okay. I want to get into some specifics, Payal. So bear with me. I understand from what you're saying that you were 15 at the time you were diagnosed. Mm-hmm. You were in high school. This is 1997, correct?
You got it.
Okay. And I have notes. They tell me that you were very active. You were on the dance team and kind of an academic scholar when you were in school.
That's right. I was very active in high school. I was very active. I was competing. I was on my state gymnastics team. I was a cheerleader. I was on the dance team as well. I was, trying to take all the top level courses in high school so that I could get some credits while I was prepping for college. I was, really just, I really felt like a star student, and, and all of a sudden in high school, when something like this kind of, I remember it distinctly. It was Memorial Day weekend in 1997. And we had family and friends come from California. My parents were very active in our church, and we had friends and family that we have, grown to love and cherish through church. Most of them in Chicago, Chicago, California. And they decided to all come to Arizona to spend Memorial Day weekend with us. And I remember prior to that weekend, I was not feeling right. I felt very heavy, very lethargic. My mom said that I looked like I was drained in the cheeks. My color was not right. So, I knew that something was off. But you kind of just pass it off as, I'm not feeling well. I'm in high school. I need some more sleep. You just you don't really think twice about it. And that weekend, because it was Memorial Day weekend and you're in Phoenix, Arizona, and it's blistering hot.
And your mom's birthday.
My mom's birthday, that's right. And you eat a lot of watermelon here in Phoenix. And as we all know, watermelon has a lot of water in it. And when your kidneys aren't working, guess where all that goes? And I think that really put me over the top that weekend. And so after that Memorial Day Monday, that Tuesday is when I presented at the urgent care.
Okay.
And yeah.
I understand that the records at the urgent care were reviewed by your aunt, who just happens to be a nephrologist. Is that right?
Yeah. So she's not a nephrologist, but she's a pathologist.
Okay. And, I misunderstood.
Yeah. It's okay. So she, thankfully, I will say, me and my parents were talking about this recently, that 25 years ago, when we were going through this, the resources and the wherewithal, the knowledge just wasn't there. And so to have someone like my aunt who was obviously in the medical field, and she was very versed in all the lab values, understanding what that meant, I think having her there was so important, because she really was our connection into the healthcare world, and being able to speak the language and understand what's going on, and telling us, not having that knowledge in the medical field, being able to say, this is what's going on, these are the next steps, and this is what we need to plan for. So yes, having her by our side was tremendous.
Okay. And I understand you were taken to St. Joseph's Hospital in Phoenix. Is that right?
Yes, that's correct. That's where I was initially, where I got my diagnosis, where the biopsy happened, and where I got my my catheter for hemodialysis.
Okay. And they put you on prednisone also at the beginning,
Yes,
right?
that's
70
correct.
milligrams every day.
That's right.
They were trying to get your kidneys to function again, and it didn't work.
Correct. That's right.
Well, I got some things right. Okay. Good. Way to go. All right. You mentioned they did a biopsy, and you also said the biopsy was inconclusive. Is that right?
That's right. Yeah. So by the time they went in, they took a sample. What they're saying is that I was just way too sclerosed over. There was no way to even determine what the cause was. And so hence why they say that it's perhaps that I was just born with weak kidneys, and over time, they kind of gave out. And tough pill to swallow, but I think that's, and we'll talk about this later on in the cast here, but talking about genetic testing and the role that it may play in something like this. I personally did not get a genetic test done, but it's been on my mind. So.
Okay. All right. So 3 kidneys. The theory was maybe 3 kidneys, and over time they wore out. You had sclerosis, which refers to vessel hardening, right?
Yep.
And they just weren't able to come up with a definitive diagnosis. Had you been tested for kidney disease prior to 1997 and the age of 15? Had you ever been tested?
No. Never been tested. Again, no family history that would, kind of urge us to make sure, that we're staying on top of it. No family history. Even during my physicals, obviously I would need a physical every year for all my high school activities. Nothing came up. Nothing came up at all.
Okay. Can you talk to us a little bit, because I know that you have a passion about this. Can you talk a little bit about the gap in education for primary care physicians and pediatricians when it comes for testing for kidney disease? Because obviously you experience this.
Yeah, I do think that it sheds some light into the gaps that we currently have with the healthcare system. Certainly, I'm not going to get into that too much, but I do feel that time is an issue. I think what needs to happen is better monitoring of kidney function, just knowing the sheer volume of people that are afflicted with chronic kidney disease, I should say, not even chronic kidney disease, but any degree of kidney disease. There should be a better checklist in place, time well spent to determine kidney function at every visit. I think it's very important. And obviously, when you hear family history, when you see any hematuria, when you see proteinuria, what more are we doing to monitor, right? And I also think that the gap between getting, the challenge with kidney disease is that it's very silent. And unfortunately, we don't know that something's going on unless, again, there's a family history and we're on top of it, or B, it's too late and we're only a few months out from dialysis. So the key question is, how can we diagnose our patients earlier? And I think that's where the miss is, and there needs to be a better checklist in place amongst the primary care doctors. And then not to mention the transfer of care from pediatric nephrologists to adult nephrologists. And certainly that brings in, a whole trifecta of things that need to happen for better care. And so there's a number of tests that I personally feel would benefit in the primary care setting. Are we doing urinalysis? Are we doing cultures? What measures are we taking to really hone in on kidney disease? And again, I only say this because we know how many people are being afflicted with kidney disease due to whether it's genetic mutations, whether it's hypertension, whether it's diabetes, whatever the case may be. And just knowing how prevalent it is, I do think that there is room to educate. There's room to train our doctors a little bit more. What I'm understanding is that unfortunately, the field of nephrology it's a rough beast, and what can we do for our clinicians to support them? And I think that's where the role of patients comes into play, that if we can be our own advocates, really learn a little bit more about our disease states, what's going on with us, that we can help make their job a little bit easier. But I digress. So
okay, I wanted to ask a couple of more questions, because I've been an advocate for pediatric patients, and I run into the same issues all the time. We had Mel Tuff on earlier in our show sequence and talked to her about this a little bit too. When you were a PEDS patient, did your nephrologist sit down and discuss with you in language that you could understand the issues about your kidney disease, going on dialysis, what was going to happen? Did that occur, or basically did they say this is what the deal is?
Yeah. No. So, when I had mentioned earlier that we transferred my care from one pediatric nephrologist to another, that was exactly the reason why, Jim. When I was initially diagnosed with kidney failure, that pediatric nephrologist did not take the time to discuss expectations. And to your point, saying in very layman terms, this is what's going to happen. These are next steps. This is what you're going to, this is what we need to expect. Understanding, getting a whole team effort involved. So dietitians, social worker, that did not happen from the beginning at all. And I think that really, thankfully, we had my aunt, who was very proficient in the medical field, but I can't imagine if we didn't have her, what we would do. There were just no resources provided from the physician. Now, when we transferred care to Phoenix Children's Hospital, I tell you what, it was a world of difference. And I think that was partially why the last 6 months of my dialysis journey was so successful. I had a dietitian. This dietitian literally would spend hours with my mom. She knew that we ate Indian food. And so walking through with my mom, lentil beans, how much protein I should be given, how much salt should be in there, moong dal, those beans that we use in our Indian cooking, garbanzo beans, every dish that I loved, my mom would present to the dietitian, and they would sit and dissect everything and determine how much of everything I should be getting. Same, social worker. I had a social worker visit every 2 weeks, maybe every 3 weeks, just to check in. Nothing crazy, but hey, how are you? What is something fun you did? Were you able to go hang out with some friends? Just those touch bases every so often makes a world of difference. Remember, you're in high school. These, and I can only imagine our pediatric patients. I mean, this is such a game changer for them, and especially to be so young and not know what's going on. Having a third party like a social worker check in is very important. And I think just this whole team effort is, I wish, and I'm hoping that slowly programs can start developing over time.
Okay. I had other pediatric patients, and I had one friend in particular, Chris Blackwell, that talked to me about, it's kind of a jarring sense to go from a pediatric dialysis lab to an adult dialysis lab. Can you describe your experience in that shift? Was it jarring for you? Was it smoother for you? How would you characterize it?
I did feel that it was smoother for me. So when I was still a peds patient when I got my transplant, but after I got my transplant, within 1 or 2 months, I was then, because I turned 16, my pediatric nephrologist transferred me to an adult nephrologist. And thankfully, I would say that it was pretty seamless. Now I know what would be some questions I would ask back then. I know now. For example, you had asked if I had children, and I don't. And a big part of that reason is, no one really sat down to talk to me and say, this is what's going to happen. First of all, as someone being on dialysis, having kidney disease, having a transplant, being on so many medications, when you're of childbearing age, what's going to happen? What should you expect? What steps should you take? Did we talk about, freezing your eggs? That topic was never brought up. And certainly at that time, it was not a high priority for me, just given my age. But certainly I do wish that these are things that were brought more into the limelight. Now, all that aside, again, I think my transition, thankfully, was very smooth. I did not feel that I got lost in the shuffle at all. Thankfully, because of the support from my parents and my aunt, who, really supported us through this journey, I felt very comfortable in knowing the questions I needed to ask and being proactive. But certainly I can see and I can appreciate where those gaps are and how we do need to be better about being mindful about those gaps for our patients.
Okay. You mentioned that you had a kidney transplant. When did you receive your kidney transplant?
I received my transplant in 1997 here in Phoenix. I was transplanted at Good Samaritan Hospital.
Okay. Do you remember the date?
May 22nd, 1997.
Excellent.
Yeah.
All right. And you also mentioned to us that you had a living donor. Mm-hmm. Who was kind enough to donate to your body?
Yep. So he's a living unrelated donor. So as I had mentioned, my family is heavily involved in our local church here. And through this family of church, one of those family members decided to donate his kidney. He is a cardiologist here in Phoenix, and he, so I think his understanding of the healthcare system and the healthcare world was also a huge benefit for me. He stepped up to the plate almost immediately. The funny story is actually his wife wanted to donate prior to him getting tested. And at the time, they had two very young, small daughters. And I believe they were only maybe 2 and 4 years old. So they were quite young. And so when it came time for her to get tested, my parents were a little hesitant because, she was in the midst of her career, also a physician, 2 young children at home. So that, and I'll tell you, I only find all this out later after my transplant, because during the process, they protected me a lot, because many people would step up to get tested and things wouldn't work out for whatever reason. And I would get my hopes up. So my parents were, not only were we absolutely sure that someone was going to donate and it was the right decision, did they even tell me that he was a potential candidate. But so the wife said, I'm ready to donate. But like I said, my family was, let's be practical here. Let's take everything into consideration. And so the husband said, well, I'm ready to donate and get tested and see where this goes. And long story short, here I am, 22 years later.
Excellent. Let's talk a little bit about your life after transplant. What are the things that you did or that you achieved after your transplant?
Oh, that's a great question. And this one always makes me very happy because, while I still feel like I want to do so much more, I have to take a pause and say, hold on, I've done so much. And so, um, after my transplant, I, of course, was able to graduate high school, which was huge, on time. And because during when I was on dialysis, I got homeschooled, and the administrators at my high school worked very closely alongside my homeschool teachers to make sure that I was keeping up with the curriculum and everything. So I was able to graduate high school on time. I went to Arizona State for undergrad and got my bachelor's in science in psychology. Um, and then I was able to go to the University of Michigan, go blue,
Go
or
Blue.
go blue.
Well, unless they play Notre Dame.
Yeah, that's true. That's fair. Um, and that's where I completed my doctorate in pharmacy. And then just within those years, just the opportunity to travel. I'm very fortunate that I've been able to travel the world, Thailand, South Africa, Spain, just to name a few. And then, of
It's a
course,
shame
meet
you
my
never go in both.
and then, of course, I've been, being able to get married to my wonderful husband, who really, I always say, between my family, which includes my parents and my sister, to my husband, um, my cheerleaders are them. They're my support team, and I truly, that's half the battle for me, is just to surround myself with good people, positive people, that celebrate my accomplishments with me. And yeah, so being able to get married, and having a great career, and quite honestly, just being blessed with good health. So
Give us a little bit of an introduction of your work currently as a medical scientist, who you work for, where they're out of, all that sort of stuff.
yeah, absolutely. Would love to. So I am a medical science liaison for Reata. Reata is a clinical stage biopharm company. That's based in Texas. And what that means is that Reata is looking at rare diseases that ultimately lead to chronic kidney disease and end-stage renal disease, and of course, dialysis transplantation. And so we have a drug. It's not on the market. We are in clinical stage. It's a phase 3. We're in phase 3 studies. And so what this drug is looking at is, does it delay the time it takes for a patient with either ADPKD, that's one clinical trial, or Alport syndrome, which is another clinical trial that we're doing. Does that drug delay the time it takes for these patients to reach dialysis or kidney transplantation? So my role as a medical science liaison is to provide knowledge, first and foremost, on these disease states. Alport syndrome is a very rare disease. It affects 1 in about 60,000 people in the United States. And there's a lot of genetics that play into it. So it'll determine, first of all, how the disease is passed down generation to generation. And then on top of it, what how are they presenting into the doctor's office? And so being that it's so rare, my role is to support physicians and talk about, how do these patients present, how are they being tested, and are we looking at family members to determine if they're also maybe carriers, are they at risk, and are we treating them early enough? And so that's first and foremost my number one role. And then my second role is to teach them a little bit about our drug. It's called bardoxolone. And like I said, we don't have FDA approval right now. We're still in phase 3 trials. But really the goal is to support the drug. We talk fair balance with the nephrologist. We talk about all the data that we've produced thus far. We talk about everything from how is it working in the body, what patient population are these drugs being tested in, and then we also talk about the safety. of the drug, of course. And so a lot of it is just bringing to light what's been going on, the work that's been being progressed in rare diseases for chronic kidney disease. And so just being able to support the company in that regards. And then on top of it, we're also starting to talk a little bit more about genetic testing and the role that that plays in, you'll hear the buzzword precision medicine, and what that means for nephrology. And so, my goal is really to dissect a lot of the literature, understand it a little bit better, understand what a clinician goes through when he sees a patient. And again, I'm in a fortunate position that I can really give them the material, the data, and then they get to choose if it's the right drug when it comes to market, if it's the right drug for the patient population. So very blessed for the job. I think it has turned into a passion project. It's opened me up to so many opportunities, to advocacy, for example. I think through advocacy or through this position, I was able to meet a lot of our mutual connections and colleagues and friends and family that we have, Jim. And that's really how I came to be sitting here today. So quite honestly, this job has been very, very fulfilling. And like I said, I approach it with very much a passion approach. And I'm hoping that I can provide some kind of knowledge and resource to the next patient so that they can thrive. That's really my goal.
Okay, well, have to do a shameless plug here because our buddy Kent Bressler is on the line, and he's trying to feed me questions every 10 seconds or so. So I just wanted to let everybody know Kent does a podcast. They're called Kent's Kidney Stories. He's had Payal on twice, and you can check out her interviews if you go to Kent's Kidney Stories or to his website, Kidney Solutions. And as you know, our buddy Kent, he helps people get kidney transplants down in Texas. He's doing a great job, and in my opinion, he's the best kidney advocate in the United States of America. And he's my best buddy besides that. So that's
Absolutely.
right, kiddnysolutions.org up there on the screen. So, all right, now you've had your kidney for 22 years. I've had my kidney for 4, and I have days when I wonder if I'm going to make it to 5, but you've made it to 22. Can you give us some tips? How can we keep our transplanted kidneys longer? How do you do that? How have you been so successful?
That's a great question. First and foremost, I do pray to the higher powers that be. First and foremost, I do think that I'm not a super religious person, but I do believe in someone or something looking out for us. But beyond that, a lot of it, what is in our control is taking our medications. That is a non-negotiable. We need to make sure that our regimens are spot on, that we and I also say this from as a pharmacist plug as well. Take your meds. That hands down, that is probably the best thing that we can do for ourselves. Also, maintain hydration, keep drinking water. We don't want to put our kidneys through any kind of acute injury just because we're dehydrated. So making sure that we're on top of our hydration, taking our meds, eating a good diet. Look, I'm the last one to preach about a good diet because I love me a good ice cream sundae cone or sweets, but really being mindful of fruits and veggies, monitoring our salt and potassium intake. Just being on top of that will go a long way. And of course, keep moving, taking a little walk around the block, doing some kind of small exercises, even in the comfort of your home. I know right now is such a challenging time with COVID going on, but any kind of movement just bodes really well for you. And I think the biggest thing is also, if you notice that something's not right, the moment you start feeling a little off, or if something's just not, if your medication regimen is not working for you, be proactive and call the doctor. Get on top of it, call the doctor and have it checked out. Because chances are there is a solution, but we just need to find it. So a lot of it is being mindful, And the funny thing is, Jim, I would say this to even a non-kidney transplant patient, you know, keep moving, a good diet, good, exercise. I mean, those are the main staples for success.
Okay. Can you talk to us a little bit about the value of having a support system? Because I know you had a very good support system from the way that you've discussed it in the past.
Absolutely. And to this day, the support system, they make me thrive, and I think I will say that sometimes the unspoken word with kidney disease is mental health. And so when I say support system, these are the people that will take in the good days and they will take in the bad days with you. And they will not throw your disease state back at you. So when I say support system, these are the people that they cheer for you, and they will support you. My parents came to every doctor's appointment with me. My sister at the time when I got sick was 7 years old. She was very young. And we always say that she kept our family very balanced. She kept it very lighthearted. She was my support system in that way because she made life a little less serious for me. My parents, like I said, making sure that my food was well taken care of, making sure that I had all the things around to succeed when I was on dialysis, when I was brought home to do peritoneal dialysis. My uncle and my dad moved around my entire room to make sure that the machine was set up properly and that it filtered correctly to the bathroom. Having just friends. When I was in high school on dialysis, I had 2, 3 awesome friends that they would come when I was doing peritoneal dialysis. They would wear their masks. They would just sit with me and we would watch a movie and allow me some sense of normalcy as a teenager. And even to this day, fast forward now being married almost 9 years, my husband, he has never, he knows how critical my medications are. He stands by me as I'm refilling my pill box. He's asking questions, which medications are which? Have I had any changes? He comes with me to my doctor's appointment so that he better understands where we are in the process. What are next steps? What should he look for in the case that, God forbid, I reject my kidney? What are those next steps looking like? So the support system there's no one typical way a support system looks, but it's really how these people make you feel and support you and create a sense of normalcy and make things a little lighthearted for you because your world has literally been turned upside down and there's a lot of unpredictability. And so having a sense of normalcy and some routine, that is I think, a big key to success.
Okay. You mentioned about the importance of taking your medication, taking your regular dosage at your regularly scheduled time. These things are kind of challenging these days during the virus. Can you talk to us a little bit about your advice about taking your immunosuppressants during the time of the COVID-19 virus?
Absolutely. So yeah, that I understand that it's very challenging and there is a sense of fear, especially being immunocompromised. We see all the literature out there on the vulnerable population having to be very careful and mindful. I think when when COVID was kind of starting to be at its peak, I believe March, April-ish, one of the first things I did was call my insurance company to okay a 3-month supply of all my medications, just in case there was a shortage, in case there was a mad rush to the pharmacies and I couldn't get anything. I had them, even though I was okay for the summer, I had them go ahead and authorize another 3 months of my medications just to make sure that I was, there was no qualms down the road that I wouldn't be able to get my medications. So that was very important to me. don't don't skip your medications. You know, obviously we all know we are in a tough situation, like I said, being immunocompromised, but that should not mean that we are not taking our medications. That does not mean that we should be cutting our medications, scaling back on the amount of medication that we're taking just so we can kind of boost our immune system a little bit, boost it up a little bit. That's not what that means. None of these things should take place without you talking to the doctor. And in terms of just I think just being a mindful citizen and being mindful of your surrounding is the key thing that you can do to protect yourself during COVID, and don't make any changes to your regimen without talking to your doctor.
Okay, so we're certainly not going to short our medication, try to take less of it so that our immune system is quote unquote stronger, things of that nature. We're not going to do those type of things as kidney transplant patients. Right. Those are bad ideas.
Absolutely.
Bad idea.
Don't do it. It's
Want to do one more shameless plug. My buddy Jonathan Trainer is on the line tonight. He's been peppering us with remarks and questions. A good young kidney advocate that recently had a kidney transplant with our buddy Kent, and has been doing a lot of online interviews with the urban outreach media, and has also been doing podcasts. And welcome, John, and thank you so much for your contributions. So shameless plug for my buddy Jonathan Traylor down there in Texas. Okay, you've talked a little bit about the functions of your job. Part of your job is to connect other people, to review the literature, and to collect genetic testing. Would that be a fair statement?
Well, so to educate on genetic testing. Yep.
Okay. And the key to your work is to discuss what we are trying to do early on to catch these patients. Patients like me, I'm a PKD patient, for example. Lost 5 members of my family to PKD. I'm the 6th. I have a 32, 33-year-old son now that's been tested a couple of times. He doesn't have it. As I told you before when we were off the air, he's been advised to take genetic testing. His father, I told him be sure and do it. Tell us about what you're doing as part of your work to try and catch patients like me early on, to try and find out, try and get a diagnosis early on, and trying to discover new things to help us.
Sure. So that's a great question. So you're right. The goal of genetic testing, and I will say, this is definitely a per institution, per doctor sentiment. So when I say that, not every physician is on board with genetic testing. And so I'll also preface and say I'm not advocating for genetic testing. My goal is to really just provide knowledge on it and understand that it is going to be a way of the world within the nephrology space over the next few years. And certainly it is a conversation to be had with the doctor to determine if it's right, for you and your family. So the role of genetic testing, like you mentioned, Jim, is really, literature is suggesting that 10% of patients that have an unknown cause, so this goes outside of diabetes, hypertension, 10% of patients that have an otherwise unknown cause of their kidney disease is actually genetic in nature. And so being that there are about 150 rare diseases that can lead up to end-stage kidney disease, you can see that there is room for genetic testing to help with definitive diagnosis. Now, many doctors will say biopsies are the way to go. And I don't disagree, but from a patient standpoint, we can all appreciate biopsies are very invasive. They're hard to do. And especially if you have to do multiple biopsies, that's not fun for anyone. That's just it's not patient-centric, in my opinion. So what other options do we have? How can we figure out what is going on in our patients, especially maybe in our pediatric patients, before it gets too late, right? As I mentioned before, often we're not presenting to a nephrologist until we're just a few months out from dialysis. And so, you had asked a great question about what are some gaps between our primary care doctors and pediatric nephrologists and or adult nephrologists for that matter. And I think genetic testing has room to provide some solutions. And the reason why genetic testing is important is that it can really help with a misdiagnosis. So, for example, if a patient was classified to have thin basement membrane disease, often you'll hear nephrologists say that that's really just more of a histological classification. That's just what we see under a microscope. That doesn't really tell me what's the long-term prognosis for a patient. So when we say genetic testing, we take it one step up and say, thin basement membrane is not a definitive diagnosis. So let's really do a genetic test to tell us what's going on. And what this can do is help with a better diagnosis so that we can adequately clinically manage these patients better. So if if they have to be started on a RAS blockade, an ACE inhibitor, or an ARB, we can do so in a timely manner and hopefully improve outcomes. Chances are a patient may get to dialysis, but what can we do to spare them 6 months, maybe a year, if not more? So genetic testing can also help with an underdiagnosis. So especially in rare diseases, like I said, things that we don't often see readily, and maybe clinicians are just not sure what's going on. Doing a genetic test can help guide them appropriately. And on top of that, I'll say that genetic counseling is very important. So, if you talk to your doctor about genetic testing, also ask about genetic counseling, because what are you going to do with these results when you receive them? Oftentimes our nephrologists may be unsure of what does this all mean, because there's a lot of scientific terminology when it comes to genetic testing. And so making sure having that support, whether it's someone in-house, so in the institution, that can dissect these results, number one, and also can maybe suggest next steps. Those are all key components to a good genetic testing and genetic counseling program. This can also, if, for example, a patient, if we already have a diagnosis for a patient, having a family member be tested, just so, again, we're catching these patients early and we can manage them better if it's indicated to do so.
Okay. When we're talking about genetic testing, can you give us the down and dirty definition of what that is, the easy layman's definition?
So genetic testing basically means, and usually the testing is very easy on the patient side. You either spit into a little tube. I know that doesn't sound very fun or hygienic, but they'll take a sample and you put it in. You can either spit into a tube or you take a swab from your cheek, and they'll put it into a test tube, or it's a blood draw. And what they do is that they'll take it to a lab and they will run a whole bunch of analyses on your sample, and they will look for DNA mutations. And they can determine through a very specific techniques that they can determine that if you have a mutation in this particular gene in this particular region, that this is what you will be diagnosed with. And so, I hope that helps. And certainly I'd be interested to know if any of our listeners have gone through a genetic testing and what their experience was. And, and I will say some of the downfalls with genetic testing is oftentimes patients don't want to know. What will they do with that information? Will it be more of a stress inducer? Also, not a lot of insurance companies will cover genetic testing. So definitely some opportunities that need to be worked out and definitely discussed with the healthcare provider. But as the field of nephrology starts to pick up momentum in precision medicine, genetic testing is becoming a little bit more widely available. And it's my understanding that there are more and more programs being available to clinicians and patients that are either very nominal in cost or free of cost. So
Okay.
I hope that helps a little bit.
Let me do a little true false with you, Priya, because or Payal, I'm sorry. Bad Jim. Let me do a little true false with you because we're coming close to the end of our hour. True or false, genetic testing can give the patient more options as far as their care and treatment.
True.
Okay. Genetic testing can let people know early enough, so that they can take better care of themselves in light of their kidney disease.
True.
Okay. Genetic testing can give you a better look at trying to delay or avoid dialysis or receive a kidney transplant.
True.
Okay. Genetic testing, there are 150 rare diseases that affect the kidney. 50% of all pediatric CKD patients have a genetic component to it, 20% for adults. That's true.
Yes.
Okay.
Sorry.
Now, I've heard you talk about a New England Journal of Medicine study with PKD patients. And Jared, this is the cue for running the link to that study. Can you tell us a little bit, a little bit about it? We got everything up there at once.
Yeah, absolutely. So in this New England Journal of Medicine paper, it was an analysis done by a group at Columbia University in New York. And they essentially took about 3,000 patients. There were 3,000 biopsies in this study taken from patients who have various forms of end-stage kidney disease. And what they found was that 10% of these patients had some kind of genetic cause to their kidney disease. And so within that 10%, they then found that 30% had, collagen 4 mutations. They had PKD 1 or 2 mutations. And what they then took was that these patients, I can't remember the percentage right off the bat, but I want to say it was about 10 to 15% were misdiagnosed initially in this patient population, or they were not even receiving adequate medical management. So it just basically, goes to show the room for genetic testing and being better able to manage patients with kidney disease, especially if we don't know what's causing their kidney disease.
Okay. You mentioned some of the cons as far as genetic testing. Let's talk about some of the pros. Explain what this has to do with clinical trials, please.
So, great question. So, in the case that you decide to go for genetic testing, and in the case that your physician, is supporting you through this process and comes up and says, we have been able to identify a mutation, XYZ, whatever that mutation may be, if you're up for it, then especially because in the rare disease capacity, there are clinical trials that if you're interested, you could be a part of. And as we all know, as kidney patients, especially of rare disease etiology, being involved with trials really benefits for the research and development of new drugs coming to market. And so, there's definitely a room, to be able to speak to your doctor and to other patient advocacy groups and learning more about clinical trials if that's of interest to you.
How does genetic testing help you with family planning? For example, I knew I had PKD before I had a child. My ex was very concerned that I would pass that along to the child, but we went ahead and had a child anyways. Can you explain how genetic testing works in terms of family planning?
Absolutely. So genetic testing basically just provides yet another platform to screen a baby, a potential fetus, for any mutations and the likelihood of a mutation being passed down, Jim, of it being pathogenic, which means highly likely that the baby would have that mutation and it lead to a particular disease state. Likely pathogenic, which means, and I'm not sure of the percentage that's associated with each, but like it's pathogenic and likely pathogenic, which means when a mutation is classified under these two categories, the likelihood of a fetus having this mutation and progressing to end stage, or any disease state, I should say, is likely. Or it'll say no risk, or variant of unknown significance, which means the likelihood is a lot less. Now, what does this mean for families? I will be honest and say many families don't want to know, because it, again, as I mentioned before, it can certainly add a lot of stress to families. But it can be of benefit because you can be on top of it. When that baby is born, you understand the management that needs to be taken, and so that you can maybe stay one step ahead, and you can not become knowledge and familiar on these disease states, and to ask questions and be prepared and support as necessary.
Okay. True or false? Genetic testing can give you a definite diagnosis as opposed to a differential diagnosis.
I'm gonna say false, because I'm gonna leave that to a geneticist to answer.
Geneticist, okay. How does genetic testing help in terms of receiving a kidney transplant and rejection? Can you talk about that a little bit?
Absolutely. So that's a good question when it comes to disease states like FSGS, especially with the APOL1 gene. I'm sure many of our listeners are familiar or may have heard about the APOL1 gene. This means that patients that are of African American descent, and if they present with FSGS, it's very likely due to the APOL1 gene. And a lot of research is being done because, of course, especially with the new initiative that was put forth last year, we want to increase the number of transplants that takes place by 2030. So what does this mean? We need to start looking into high-risk donors that are interested. So does the APOL1 gene deter a potential donor? And so having that knowledge, if a potential donor has the APOL1 gene, should that patient not donate? And why not? Or what is their risk of being able to transfer that to the recipient? What is the likelihood of rejection in the recipient? So genetic testing with the right knowledge and the right support from your nephrologist and a geneticist, they can help break that down for families.
Can genetic testing help to tell you whether or not a certain donor is compatible with a certain recipient, whether or not there's a possibility of rejection?
So it's not so much compatibility, because that's going to go into the antigen testing and so on and so forth. This is purely more to understand what mutations are present. I would probably have to defer the question on the possible risk of rejection. I don't know the numbers on that offhand, but I do know that it can be used as a test to test for donors and the risk of rejection, but I don't know what those numbers are.
Okay. I've heard you speak that summaries for genetic testing can be complicated and difficult to understand. Is that why you feel so strongly about genetic counseling, having somebody that can translate the results into plain English so people can understand what they're talking about?
100% correct on that.
Okay.
Yep.
Okay, question that I'm asking everybody that's been on the show, particularly kidney transplant patients that have been successful, like you have been. During Cyrus the virus, what steps are you personally taking to protect yourself? Yep. What kinds of things do you do to make sure that you stay safe?
Sure. So I am pretty much homebound. Thankfully, so for my job professionally, I do travel a lot. I cover basically the entire southeast portion of the country. So I do travel a lot. When COVID hit, our company put us all on a travel ban. So that was certainly very helpful. In terms of my day-to-day, I try and get a lot of vitamin D, so a lot of sunshine, and I try and incorporate my diet with a lot of fruits and vegetables just to keep my immune system up. Of course, hand washing is a absolute must. It's almost incessant. I always keep a bottle of lotion because like my hands get so dry. That's how much I'm washing my hands. A mask is an absolute must. I certainly, I live in Florida where there is not a mask mandate. So I try and make sure that wherever I am, and, if I have a few friends coming over, everyone has to have a mask on unless they're eating. I try and supplement with a little bit of vitamin C and a little bit of zinc. So I do take some vitamin C effervescent tablets, or I take a little bit, under the tongue, or of course, oranges are the best place to go for that. But anything just to kind of boost my immune system, just to ward off any of any viral particles I can. I try and do that. And quite honestly, I just try and stay put as much as possible, and exercise. I think exercise is a good way to keep your health up and boost your energy levels, and try and get as much delivery as possible. Grocery delivery, shopping deliveries, anything. Just don't go out as much as possible.
Okay. Last question, Payal. Is there anything that I forgot to ask you about that you wish I had? Is there something else that you would like to discuss with our audience that Uncle Jim just plain old forgot?
No, I think you did an excellent job, Jim. Thank you so much. And, really my goal for this was, I hope I can be a resource. I hope I can be at some level an inspiration and a support for all of our listeners, to know that I'm here. And certainly if I can offer any support, advice, and just an ear to listen, please don't ever hesitate to reach out. We're all in this together, and I want the next person to be as healthy and as happy as possible. Great.
Well, I appreciate very much you taking time with us, and I hope that I can have you back sometime and we can talk a little more about the things that are going on in science. So thank you for taking time. Okay, folks, next week I have something special for you. I have Bobby Reed and my friend Candy Gagne are going to be on. We're going to talk about kidney legislation and the Living Donor Protection Act in Pennsylvania. Going to go to the full Senate, the full Congress in Pennsylvania this week. Could be signed by the governor by the time that we talk. And I want them to describe for you the effort that it takes to get something like that done. Stay tuned. The Urban Network has a show that comes on right after mine. You don't want to miss that. And be sure you don't miss the Lisa Baxter show on Sunday nights. Lisa's a very strong supporter of Kidney Stories, and another shameless plug to end our discussion tonight. And make sure you check out her show. She always does a great job. So I appreciate you taking time. I appreciate Payal coming on tonight, and had to put my Poindexter on a little bit because, boy, she's really smart. And I will see you guys next week, and we'll talk about legislation. Okay? All right. Everybody take care, be safe, and we will talk soon.